So it was the issue about starting the webinar. Oh yeah, but there's still nobody on the screen. The camera is not showing. Even though we're yeah, makes sense.
I think we need to think how to write what this, set off. The reality is.
Yeah, no, I think
He is.
right.
Differently.
A lot of people there.
Yeah, and there's like
Hi, hello everyone. We'll start in a couple of minutes. We're just waiting for actually quite a number of people that were left inside the shuttle. And on their way.
He's on my committee, so they'll be helping decide, but I think I agree. But as
Thank you.
but I serve at RTI and
So
doing
Right.
on the Washington.
yeah, I'm not worried about him.
We'll just wait
So right
a
now.
couple more minutes.
Yeah, I think the tech stuff should be addressed. so-
It's been addressed now.
Okay.
The challenge was actually the shuttle because half the people that were supposed to be part of this
Oh, we're supposed
were
to
in the
have
shuttle.
thoughts.
We still
Well,
can't see, we still can't see the, okay, there we go. We can see the room
We'll start
now.
it out.
Yeah, we can see now.
Okay, perfect. They're just gonna adjust the camera so that it actually.
So that's one at my.
Would you like-
He's gonna see two different. papers. They will help me decide which one to prioritize of these two papers, and after that one can, then I'll do the other one, but I have a draft paper, it's that one.
Which direction did you want the camera?
So that it's not facing that wall.
Right.
Or that wall with the center.
Oh, okay, I see.
Yeah.
Yeah, hi.
There you go.
Yeah, that's cool.
Perfect.
All right. You're all set?
Thank you. Yeah, I saw you guys in the shuttle. Right. Hello, everybody. Welcome to the session on rethinking rural sanitation from conceptualization to operationalization towards universal access. I know that's a really long title, but what this is really is about an idea of coming together on a set of principles across multiple organizations so that we can have one voice towards how we approach rural sanitation. It started actually with Eric Harvey from WaterAid, myself, and Darren Saywell, who was at the time with Plan International. And the three of us were at a Gates meeting, and a lot of the work that was coming from Plan International at the time on costing CLTS and the effectiveness of CLTS was happening. And people, and we were learning things at UNICEF. By the way, my name is Michael Milo. And I work for UNICEF. I'm a water and sanitation and hygiene specialist. And when we were saying, oh, WaterAid is learning all this stuff on sanitation marketing, we were learning all this stuff on CLTS. We wanted to kind of like find an opportunity to say, well, are we measuring the same things together? Are we doing similar things? Can we even compare the results that we're achieving? And we're oftentimes working in the same place. Hi, sorry. And so that idea came together back in 2017 to actually start reviewing. It was 3 tasks that we wanted to do. The first task was actually to do an evidence review around all our different experiences, plus what was out there in terms of publications, and try to come up with an approach that just kind of took us beyond just using a standard approach with each organization, but rather a more context-specific approach to addressing rural sanitation. And today, I think this is, with all the discussions around scaling safely managed sanitation and working on urban, one of the other reasons why we were doing this, as you guys know, in the JMP, it's still being reported that about 500 million people are still practicing water purification. And amongst those 500 million people, about 92% of them are in rural areas. And we're fortunate today to be joined by people who have done quite a bit already from Cambodia and also Nigeria, from the government, but some of them will be online as they didn't make it here. But we're also here with our water aid colleagues from Water Aid America, but also Water Aid UK through the online system. So basically what we'll do is we'll go through a little bit, I'll tell you a little bit about the background of the work that we're doing and the rationale behind it. And then afterwards, we'll start to hear about some of the training that we've been doing through Maya, who's my counterpart. And then we will also listen to Cambodia and then a video from Nigeria. And originally I had planned to do some group work, but I think we won't be able to do that today. And since we're not that large of a group, I think we can go straight to plenary. We also have Morris with us from WASH Pals, USAID project, and they'll be able to kind of share how this work has been relevant to them. So I discussed a little bit the purpose of why we were doing this. It's really, we wanted to see a more equitable approach to the way we do rural sanitation, where we didn't just leave pockets of places that did not achieve the results and move on to the next, but rather ensure that no one was left behind. And again, one of the key areas here is, even as though we're moving up the ladder, one of the challenges that we still have is ending open defecation. According to the JMP, it's likely that we're going to hit the 2030 target for ending open defecation. However, there are countries that the progress is actually going backwards. One of the things that we came up to think of why the progress was going slow was because there were inadequate approaches. There wasn't a lot of collaboration amongst partners. There was poor political prioritization, and there were knowledge gaps. So as I was sharing earlier, we did a review of the approaches. We developed some guidance, and then we started to do some piloting of those trainings and executing them at country level. This publication was actually done by a commission by the 3 organizations and was done by UNC and published in 2017, which was the basis of the guidance that we developed, which was partly done by Andy Robinson, who's here along with us, and also a costing guide that was also put together. And then we also worked with Open University to get it into an online open course. There were 3 goals in terms of what we were trying to achieve. We wanted to achieve scale, again, equity, and also sustainability. But I think there were also principles that we wanted to follow. One of them was, given the kind of challenges we were talking about, we wanted to achieve, we wanted to put partnerships at the heart of it. We wanted to stop just talking about households or communities, but actually entire area-wide administrative areas. We wanted to also make sure that people didn't just use an approach, a cookie cutter approach, but instead kind of make sure that they use context-specific and evidence-based approaches with regards to addressing their issues in that country. And we wanted to promote flexible and adaptive approaches, which mean and allowing the shifts in terms of how it's being implemented, depending on how progress is being achieved. I think one of the other reasons that we're doing this session today is we wanted to speak about how something like this actually, how long it takes to actually get into what we would like it to be, which is results in the field, right? And I think everyone in here, whether you're a researcher or a practitioner or a policy, or someone who's in academia, all our goal is all our work is actually being done in the field. So one of the things that we thought in addition after was to kind of get together with other groups outside of Plan and WaterAid and UNICEF and get a larger group of people to follow this. So this actual call to action, which followed many of these same principles, included USAID, the World Bank, SNV, WSSCC. So we started to kind of expand the sector common vision around this space. We also worked with the Institute of Development Studies to produce additional guidance that were being asked by the people that were getting trained on challenging contexts. So we did a desk-based review. So there's stuff that grew along the process. And at the same time, there was a project that was being run by USAID called Wash Pals, the first iteration. And a lot of learning from that, and a lot of learning from SNV, from the payment by results and SSH4A. And we did a learning event last November 21st. Last November 15, 2021, and actually ran a couple of webinars in early January. Again, promoting the same principles that I've shared earlier. No, I'll stop there. From here, I'd like to be able to kind of share with you a video from my colleague Maya. Maya is from WaterAid UK. She's a senior advisor for sanitation. And she also used to work with us in UNICEF. And she has several years of experience. But Maya, I'm gonna show your video. She's also online with us.
Good morning and good afternoon, everyone. My name is Maya Igarashi-Wood from WaterAid UK. I would like to share here how the Rethinking Rural Sanitation guidance was translated into practice through the 3-tier training programs for the last few years. In order to facilitate the uptake of the Rethinking Rural Sanitation guidance by practitioners and governments, 3 types of training courses were developed. First one is a brief introductory course to the principle of rethinking rural sanitation, fully online. Second one is rethinking rural sanitation in depth, which has one part of training online, the other part in person with group discussion. Third one is rethinking rural sanitation in practice, 5-day fully face-to-face. Why 3 different types? Because the needs of different organizations and individuals vary in terms of knowledge and skills. These training courses were designed to meet those different needs and to be complementary. In this format, we believe that it could reach a wide range of audience and is contributing to the wide adoption of the key principles and sectoral shift in sanitation programming. Now, I would like to explain a bit more details about each training course. The introduction to rethinking rural sanitation targets the rural sanitation practitioners and people from the overall wash sector. It aims to provide a brief overview of the principles. By the end of the course, the participants would be able to recognize the need for rural sanitation programs to be adaptable and context-specific. Identify the information and evidence needed to analyze the country and the local context. Describe the essential components in the design of equitable and sustainable area-wide rural sanitation programs at scale. assess the suitability of different rural sanitation program design in light of specific country and local situations, and explain the importance of working with different partners, stakeholders in the planning and implementation of such programs. The course is on demand, so you can complete the 6-hour course at your own pace, free and accessible from Open University website by anyone, as well as internal learning platform for WaterAid, UNICEF and Plan International. The Rethinking Rural Sanitation in-depth, so-called blended training program, was built on that Open University online course, expanding the level of details and adapting the mode of delivery. It targeted the WASH technical specialists as well as national and regional government decision makers and planners. The first cohort were about 25 people from Cambodia, Ethiopia, Nigeria, and Zambia. The training offered an in-depth look at the principles of programming for rural sanitation and how to contextualize them. The course covers the same 6 sessions, like the introduction to rethinking rural sanitation, but by the end of it, the country team would be able to develop a concrete action plan based on their national context, what to change and to do more to adopt the principles. The course was delivered by a facilitator at national level. They used a pre-recorded PowerPoint presentation with voiceover that they could pose for group discussions and question and answers. Each session ended with an activity that was intended to build up towards a plan for an adapted rural sanitation program. A 30-minute introduction was prepared for facilitators so they understood the role and how to manage the presentations, as well as trainer's manual. The course was designed to be flexible. The schedule can be adapted at the national level to suit participants' needs. In total, it requires about 26 hours of learning time over a period of around 13 weeks. The Rethinking Rural Sanitation in Practice training course offers the opportunity to learn how to develop a contextualized and costed area-wide rural sanitation plan through an in-depth look at the principles and a practical explanation on how to use relevant tools. The course had 8 core modules as displayed here, from understanding of the rethinking rural sanitation principles to practical exercise on costing of a rural sanitation plan. The detail of how this was operationalized will be shared by Nigeria, so I will not explain any further here. Over 100 people participated in the introduction and the Rethinking Rural Sanitation in-depth courses. The guidance on rural sanitation programming in English, French, Spanish, and Portuguese has been downloaded about 900 times in the last 3 years. The Rethinking Rural Sanitation in-depth course was developed based on the training needs assessment. Hence, the content was well targeted toward the areas of knowledge and capacity needs. The feedback indicated that although individuals did not necessarily feel confident in the topic, they felt that the knowledge gained in combination with the improved relationship made during the course enabled the cohort as a group to address the issue collectively at the country level. The principles of rethinking rural sanitation have been introduced not only to the 4 countries which took the in-depth course, but also Rwanda and Niger through the partnership. Donors like USAID have taken fully the principles integrated into their global approach to rural sanitation programming. However, the uptake and delivering results on the ground takes time and it requires continuous support and learning. Through a new partnership between WaterAid and UNICEF, we will continue supporting the first cohort countries, especially Cambodia, Ethiopia, and Nigeria, in addressing existing challenges in programming and advancing their sanitation ambitions. In addition, the next step aims at shifting the ambitions from reaching national ODF to universal access to sustainable and safely managed sanitation. By learning from the experience in these countries, the training package will be updated with more practical content on improving area-wide implementation, such as the context-specific actions and the practical methods of gender equity and inclusive programming at scale. Thank you very much.
Thank you, Maya, and perhaps if there are any questions at this point, Maya, you can hear us, right?
Yes, I can hear you.
Are there anybody with questions for Maya? Any clarification questions at least? If not, we can move on. Okay. Thanks. Oh, yeah.
I have a quick one. Do you know how many people took the online course?
So we know that on the WARE kind of website, it's a certain, I think it's the 900 plus the Open University one. What it doesn't take into consideration is the training is actually on 4 platforms. So the Open University platform, there's the WaterAid internal platform, there's the UNICEF internal platform, and Plan International was starting to put the training into their platform around earlier this year. I need to check back with them whether they've successfully done so. I haven't checked yet with regards to how much UNICEF has also gone big, but I know that there are certainly like countries like Mali that have run took 8 people from the government, UNICEF and their partners, and ran the course together on their own without us. Yeah, because we had, I recall we needed to rush getting it done in French because they wanted it. But also I think the important piece is like it hasn't been impressive, the outcome, right? So I think like one of the purposes of this is we wanted to kind of solicit from you guys what's the best way of getting kind of stuff like this forward. You know, we're coming up with a game plan. We want to create new training modules for safely managed sanitation. And you know, it's been 7 years since we've been doing this. We think the stuff that we're doing are relevant. Hopefully those that did take the training can tell us whether or not it was relevant to them. So I'll stop there for now. And yes.
One more question.
Yes, please.
I was just curious if you have a sense of how these principles and actions have permeated through the different organizations, through UNICEF, through WaterAid, through Plan, down their staff, and is it sort of the foundation of the kind of programming that's happening now?
Right. No, I think that's a great question, Morris. Maya, do you want to take that one? I have my thoughts for UNICEF.
Sorry, I couldn't hear very well, but
Right, so the question is, how has these principles of partnership, area-wide, evidence-based and adaptive management have kind of been taken up in WaterAid?
okay. Thank you very much. I think there might be some overlap with the answer from Mike as well, because in the countries where we kind of delivered, particularly the Rethinking sanitation in-depth course, that we really work together in partnership to support the government to take up on in practice. But in water specific, definitely the countries like well, Nigeria and Cambodia, which are going to present a bit more in detail, as well as Ethiopia. And then the thinking and the principle has been is shared internally through some webinars and the meetings, and in certain discussion at the different country level, including other Rwanda and Niger. Those are the kind of key examples, if I could say.
I think so. That's kind of partly related to my answer, at least in the 4 countries that we've started to implement them, it really created a space for, because so the course, when it's run, particularly the guided cohort, it's run where you bring plan, water aid and UNICEF and the government in and take the course together. Right. So I think in that sense, some of them never even met each other. So I think it's interesting that something like this can start to kind of at least spark a conversation. With regards to how they kind of end up collaborating, I think these 2 examples that we have are going to be a good sample.
Yeah, the question was, to what extent are these organizations leading by example?
Right. Yeah.
That's what the example.
Okay. Let me just put this up. So we have 2 people here from Cambodia. From Water Aid, we have Soka Mok, who is a program manager for water system strengthening in Water Aid Cambodia. He has more than 10 years of experience in developing programming, including systems approach, community development, climate resilient and inclusive wash, urban sanitation in challenging environments. He has a master's degree in development management from the Asian Institute of Management in Manila, and significant experience in developing tools and training manuals on capacity building, and specifically around private sector engagement. We also have Dr. Lon Sai Teng, who is the director of the Department of Rural Healthcare at the Ministry of Rural Development in Cambodia. He's been in this position for about 4 years now, and with a degree in medicine, he's been working in the rural health and sanitation sector for 25 years. And he's the rural sanitation champion accelerating the ODF achievements in Cambodia. So let me hand over to the 2 of you, who's going to be doing a tandem.
I can stand for a second.
I cannot speak English, but Mr. Sukha in help me about the presentation. សួស្តីអស់លោកលោកស្រីទាំងអស់ដែលមានវត្តមានទីនេះហើយក៏ដូចជាអ្នកដែលចូលរួមតាម online.
Good morning to all of you, and again also good morning to everyone who joined online.
ខ្ញុំសូមបង្ហាញអំពីបទពិសោធន៍នៃការអនុវត្តកម្មវិធីទឹកស្អាតនិងអនាម័យនៅក្នុងប្រទេសកម្ពុជា
But I'd like to give a short presentation on our experience in the acceleration rural sanitation program in Cambodia.
ហើយការបង្ហាញរបស់ខ្ញុំនោះមានចែកចេញជា3ផ្នែកគឺទី1គឺលទ្ធផលនៃកញ្ញាប្រឈមហើយនឹងដំណោះស្រាយ
So here as a context, we have 4 main contexts. So about context, so we have context relevant to the guidance, relevant of the guidance to the country, result and challenge, and also way forward.
តកតងទៅនឹងប្រធានបទនេះសូមជំរាបថារដ្ឋាភិបាលនៃប្រទេសកម្ពុជាបានរៀបចំជាផែនការយុទ្ធសាស្ត្រលើកកម្ពស់ទឹកស្អាតអនាម័យនៅឆ្នាំ 2025 ឲ្យសម្រេចបាន 100% ទូទាំងប្រទេស
So from that result, we just want to highlight that the Cambodian government has set a clear plan of achieving open education free target by 2025.
បច្ចុប្បន្ននេះបញ្ហាទឹកស្អាតនិងអនាម័យប្រជាជនប្រហែលគឺថា 80% ហើយបានទទួលសេវាទឹកស្អាតនិងអនាម័យ
So recently we have achieved up to almost 80% of rural population access to basic sanitation services.
នេះយោងតាមប្រព័ន្ធតាមដាននិងត្រួតពិនិត្យរបស់ក្រសួងអភិវឌ្ឍជនបទបានអនុវត្តរាល់ថ្ងៃ
So this data is from our assistant from Ministry of Rural Development of Cambodia.
ហើយខេត្តប្រហែល6ដែលនឹងត្រូវសម្រេច ODS នៅក្នុងឆ្នាំ 2023
So beside the plan, we have set a clear target of achieving at least 6 provinces to become ODS, and then now recently we achieved 2 provinces only by 2023.
ហើយ តកតងនឹងដែរដើម្បីពន្លឿននៅអត្រាអនាម័យយើងបានរៀបចំនៅ tool rethinking sanitation tool ដែលអនុវត្តកន្លងមកនេះ
So in the part of relevant to this guideline to the country, because guideline is very aligned with the national commitment, especially try to accelerate area-wide sanitation coverage. So we have been trained and learned from the rethinking rural sanitation tool from our colleagues, mainly from our body team in Cambodia.
ជាដំបូងគឺថានៅក្នុងស្រុកមួយបានសម្រាប់ ODS ក្នុងចំណោម175ស្រុកដែលអនុវត្តកម្មវិធី tool នេះ
So then we start at least in I think early 2008, 18 and 17, we got at least we have one district achieve open education district in 2017.
សូមបញ្ជាក់ថា tool នេះយើងត្រូវអនុវត្តនៅក្នុងខេត្ត2ជាដំបូងដែលបាន achieve មួយស្រុក
And then we start to pilot, based on the tool. In order to roll out the tool, we started to pilot 2 provinces to become an open education provinces.
ហើយអង្គការ WTF ហើយនិងអង្គការ UNICEF បានសហការគ្នារៀបចំសាកល្បងនៅ tool នេះទៅតាមតំបន់ផ្សេងៗទៀត
And this tool is under WTF and UNICEF partnership. And then this also we also provide training to the national trainer, but also for them to also scale up to other province as well.
បាទបញ្ចូលនៅក្នុងប្រព័ន្ធ MIS ហើយនិង WA យើង commit ថា5ខេត្តត្រូវតែសម្រេច ODS នៅឆ្នាំ 2023
And this commitment not just only for the national commitment, but also because the Cambodia government has been involved as the member of FWA. And then as part of FWA commitment, that national government had to achieve at least 4 provinces to become ODS by 2022.
តើយើងបានធ្វើអ្វីខ្លះនៅក្នុងការអនុវត្តនៅ tool នេះយើងបានពង្រឹងសមត្ថភាពទៅដល់ថ្នាក់ក្រោមថ្នាក់ខេត្តថ្នាក់ជាតិថ្នាក់ក្រោមជាតិហើយនឹងព្រមជាមួយនឹងការផ្ដល់សិទ្ធិជាម្ចាស់ក្នុងការអនុវត្តកម្មវិធីការនេះ
We have provided our training to not just only for the national trainer, but also to local authority, sub-national authority, and then also trying to motivate them to be, to have ownership for this tool and guidance in order to promote their rural sanitation in their target provinces.
ហើយការអនុវត្តសំខាន់នៃការអនុវត្ត tool នេះយើងបែងចែកទៅតាមតំបន់ហើយនៅក្នុងនោះមានចែកជាតំបន់ជនបទតំបន់ជាប់ផ្លូវជាតិតំបន់ទីក្រុងហើយនឹងតំបន់ដែលមានអនាម័យក្នុងបរិស្ថានប្រឈម
So just to highlight about what are the main components in the guidance. So in the guidance has been set, in clear target areas. So we have 4 target areas based on their typology. So we have defined rural remote, rural on road, rural make, and difficult context. And then also key intervention also list out, recommended intervention also list out in each target area.
ហើយក្នុងនោះយើងធ្វើការចំណាត់ថ្នាក់ឃុំដែលត្រូវអនុវត្តនោះតើត្រូវអនុវត្តទៅតាមការបែងចែកតំបន់នីមួយៗយ៉ាងដូចនេះដែលក្នុងនោះសូមជំរាបថាឃុំដែលជាប់ចំណាត់ថ្នាក់គឺយើងអនុវត្តទៅតាមការបែងចែកនេះ
So in order to select commune, first of all, if you want to really understand the community sit under each typology, we create a very simple tool, actually just for simplify the tool a little bit to have our practitioner, mainly our local authority, to understand where and how the community fit for each typology. So these are the key category and tool for them to score themselves and put the score based on the criteria. Yeah.
ហើយក្នុងការអនុវត្តនៅកម្មវិធីអនាម័យរបស់យើងអនុវត្តនៅ tool 3ដែលក្នុងនោះការផ្លាស់ប្ដូរអ៊ីយ៉ាប័តអនុវត្តកម្មវិធី CLTA ហើយទីផ្សារហើយនឹងការរ៉ាញ់វត្ថុ
So here just to highlight the main program intervention that tool has been implemented. We have three main interventions in that tool. So one particular focus on behavior change, market-based approach, and financing strategy. So based on here, we try to support our partner. For example, if we talking about behavior change in particular area, what does it mean for them, and what are the type of behavior change that need to be done in their target area?
ហើយជាលទ្ធផលយើងបានអនុវត្តនៅ tool នេះនៅក្នុង37ស្រុកហើយនៅក្នុង4ខេត្ត
So as a result, it has been applied this to over 37 districts within 4 target provinces in Cambodia.
ហើយនៅក្នុងការតាំងចិត្ត5ខេត្តត្រូវតែបាន ODS នោះយើងឥឡូវនេះយើងបាន2ខេត្តហើយ
Yeah, so now we got 2 provinces to become ODS and one more are waiting for official declaration.
ហើយយើងនឹងពង្រឹងសមត្ថភាពនិងភាពជាដៃគូជាមួយអង្គការទាំងអស់សម្រាប់បណ្ដាលនិងចែកចម្លែកការងារនេះទៅតំបន់ផ្សេងៗទៀត
So we will continue our collaboration and partnership with all NGO partners in Cambodia to scale up this tool as well as provide more training to sub-national local authority.
ជាមួយនឹងការអនុវត្តបានសម្រេចនៅផែនការក៏ដូចជាការអនុវត្តជោគជ័យនៅទូនេះយើងក៏មានបញ្ហាប្រឈមមួយចំនួនហើយ
So based on the result and also the program implementation strategy, we also face some challenges.
ទី1គឺអនាម័យក្នុងតំបន់របស់
Yes, so the first one we want to highlight is about sanitation in challenging environment. That we need to explore more solution, more technology to address area.
ទី2គឺបញ្ហាសង្គម social ហើយនឹងទី3ទៀតគឺបញ្ហាមួយទៀត
That's all the ODS.
ហ្នឹងហើយទី1ទៀតគឺយើងអត់ទាន់មានគោលការណ៍នៃពីការតាមដាននៅ ODS ក្រោយពីយើងបានសម្ដែង ODS.
Yeah, so the next one is about social context. Actually, mainly how do we, because in other context, particular context, marginalized communities still have an issue with understanding and also behavior in access to water services, and that's why it's hard for us to really convince them to accept, in order to use Latin. For example, in the ethnic community, people tend to go to the forest rather than defecate in the toilet. So that's why one of the main challenges that they are facing now. And the last one is about lack of the tool and also strategy to support post-order intervention.
ចំពោះដំណោះស្រាយវិញយើងមានដូចតទៅដំណោះស្រាយទី1គឺយើងក៏រឹងសមត្ថភាពថ្នាក់ជាតិនិងថ្នាក់ក្រោមជាតិហើយទី2គឺយើងពង្រីកការអនុវត្តនៅទូនេះទៅតំបន់ផ្សេងៗទៀតហើយជាពិសេសយើងជំរុញខាងផ្នែកទីផ្សារហើយសហការជាមួយដៃគូដើម្បីអនុវត្តទៅលើតំបន់ដែលមានអនាម័យប្រឈមនេះហើយមួយទៀតគឺការទៀងគោលនៅតាមការសម្រាប់អនុវត្តការនេះ
So here are the way forward that we like to do. So basically we have a national core master trainer. So we will continue to provide that training capacity to them for them to be able to continue to support to national authority. And then our planning also to scale up this tool to other target area as well. And then as well as we intended to really considering to introduce this tool in the upcoming national action plan review soon. So will be helpful for the national government to accelerate the sanitation services. And then the last one is will continue to collaborate with stakeholder and partner in order to support and also accelerate the sanitation service, in particular in the challenging context.
កម្ពុជាសូមបើកចំហនៅការគ្រប់គ្រងនិងការជួយពីបណ្ដាអង្គការដៃគូក៏ដូចជាអង្គការជាតិទាំងអស់ដើម្បីធ្វើឲ្យសម្រេចនៅគោលដៅជាយុទ្ធសាស្ត្រនៅឆ្នាំ2025 100%.
So we just like to finally mention is by Cambodia is welcome to all NGO partner and supporter who are interested to work in Cambodia in order to achieve national target by 2025. Thank you.
Thank you.
Thank you. And before we go to our Q&A, we will also listen to Nigeria, and then after which we'll put the Cambodia colleagues plus also Morris on the hot seat. Let me show the next video.
Welcome to Nigeria.
Let me introduce him. So what we have is Dr. Martin Oduvier, the director and coordinator of the Rural Water and Sanitation Center at the National Water Resource Institute in Kaduna, Nigeria. He has over 39 years of experience in hydrology, water resources, with particular experiences in groundwater investigation, development, water resource and integrated water resource management for both urban and rural water supply. He holds a PhD in hydrology and has led on several water supply and sanitation projects in Nigeria. And let me bring Dr. Idris video.
Nigeria, rethinking rural sanitation costs in collaboration with WaterAid Nigeria is our topic this afternoon. My name is Dr. Martin Oeduvi. I'm the director and coordinator of the Rural Water Supply and Sanitation Center at the National Water Resources Institute in Kaduna. We're looking at the basic statistics from Nigeria, the relevance of this in terms of the institutionalizing the costs, some of the results that we've obtained, challenges, and the next step. In terms of the country context, Nigeria has a very large population, with almost 1 in every 5 or 48 million people practice open defecation. We only 10% of the population at the moment has access to basic water, sanitation, and hygiene services, all combined together. The challenges faced led to the declaration of the state of emergency at the highest level in WASH. There is prioritization of the sanitation at the highest level of government with the launch of the national action plans and the Clean Nigerian campaign. Presently, few challenges remain, and that is why the need for this particular course so that we can move forward. The Institute is the capacity building arm of the Institute under the Federal Ministry of Water Resources with clear mandate to ensure that the capacity building and research are carried out at the appropriate level in the sector. It also has the UNESCO Category B Center, the River Basin Management, where most of the West African countries also come for studies and of course research activity. People from the local governments, community and states with engineers, technicians, they all be trained at the National Water Resources Institute, and we also carried applied research. In addition to this, we also advise the Honorable Minister on the various national water resources needs of the country. Presently, there's a partnership with WaterAid, which is very important. The national water resources has always been scaling up in terms of this to maintain sustainability. We've run a lot of short courses over the years, and of course, with a lot of training experience as we have over the years, while the water aid on the other side has quite a lot of global experience in wash activities. And they'll also be partnering and collaborating with UNICEF and playing international from the global perspective to ensure that this cause is institutionalized and domestic. The relevance of this has contributed quite a lot in terms of sanitation pillar of the National Wash Action Plan through the various assistance and capacity building. The implementation of the National Open Defecation Free Days has really been very, very useful, especially on the campaign on the Use the Toilet. Nationwide blanket program with CLTS is being on, but this particular thinking sanitation has a lot of analysis in terms of being addressing the contents of this to make it much effective so that open defecation free nation can be achieved. There's a need to increase the capacity to implement most of these rural water sanitation in Nigeria. Because itself is targeted to professionals, CSOs, and the rest of them that are part in the field, we also have the content to increase quite a lot of the knowledge and the skill with 8 modules: rethinking, rural sanitation plans, national analysis, stakeholders, and partnership. There's demand and supply aspect of top of the cost. The capacity building development is there. There's a need to also monitor, evaluate, and of course, share some of the learning experiences in whatever that is happening at the field level. Of course, there is costing and of course the funding component of it that will enable people to cascade most of this and improve on the various services of rethinking rural sanitation is very key. The course is quite accessible in practice. It's being executed at the Institute in terms of face-to-face training, required meeting rooms, and of course, both lecturers and facilitators that are quite involved. They deliver through training institutions, especially with other training network center that we have. Practical tools utilization is there. So it's quite a mixed participant group, for example, with technocrats and various planners, policymakers, and that frontline practitioners are quite involved. The duration of the course is just 1 week and has a mixed grid of PowerPoint presentation, group work activities, lots of interaction and use of tools. The result that we have so far, an MOU with WaterAid Nigerian on this RRSC in Nigeria has been well established and is being implemented accordingly. We've been working with UNICEF, with WaterAid for quite some time now. WaterAid is also collaborating with UNICEF to ensure the strengthening of this cause. A lot of this course has been developed and institutionalized at the National Water Resources Institute, domiciled around water supply sanitation. Staff capacity is being strengthened, and of course, quite a lot of these course modules are being reviewed by collaboration with UNICEF, Federal Ministry of Water Resources, and other critical stakeholders. Two of these sanitation practitioners in terms of the training has been done at the national and of course subnational level with over 60 participants trained. The National Council of Water Resources has been duly informed to have the political will and encouragement and support to ensure the actualization of this particular course. What are the few challenges? Limited awareness is generally being done to ensure that people are very much aware of this course to actualize the open defecation, especially on that sanitation issue. Inadequate funding of the end of life to conduct this, what will ensure that it's highly domesticated, and people must fund this, especially the federal, the state government. Inadequate capacity to implement this is there, but we are doing a lot of training in collaboration with OTAI to improve. At the end of it, what is the next step? The market for the RRSC short course to commissioners and Ministry of Water Resources at the state level, relevant ministries in terms of the environment, for example, and other agencies that are utilized. Most of this training are there in the local government. There's a need to conduct resource mobilization in terms of funding allocation to support the capacity building of this and disseminate quite a lot of this development of these courses in the 2022 and 2023 short course of the Institute. Beyond that, we ensure that the integration of this RRS is fully institutionalized so that the implementation and principle of WASH curriculum, both at the university, polytechnic, and of course secondary school, including primary school, is highly institutionalized for better implementation. And of course, a model of this RRSC implementation in terms of the principle will further enhance the sanitation activities in Nigeria. I thank you very much for listening, And I wish you a very good day. Thank you.
Thank you, Dr. Duvier. And before I start to put, you may perhaps you can sit here. But before we start with the panel discussion or large group discussion, could I ask Morris, please? So around the same time that we started this thing, USAID launched a project where Morris was the chief of party through Tetra Tech and several other institutions. And we saw a lot of kind of similarities with what we were trying to achieve and decided to kind of put our heads together and even expand that further. So Morris?
So now our heads are even bigger. All right, so good morning, everyone. As I said, I am Morris Israel. I'm currently the chief of party for the second iteration of Wash Pals 2. So first of all, tremendous thanks, Mike, for the invitation, and really I speak on behalf of USAID here. So thanks for the opportunity to share some of our thoughts on the collaboration over the last couple of years, but then also really for the partnership that's been developed over really the last 5 years. And it really, I think I'll mention a few things as we go through, but it hadn't been, I hope for you guys as well, an example of what the P in the partnerships is meant to be, where you have multiple organizations sharing a common approach and a common language as it were going forward. I think it was quite illuminating to hear the two examples of implementation and how these concepts are happening on the ground. What the thoughts that I'll share now are not about implementation. As you may know, Wash Pals is a research and learning project. It's not an implementation project. So, being able to extract some of these concepts and make them happen on the ground, I think it's fantastic to see. It's fantastic to see how they've been adopted and contextualized, both in Cambodia and in Nigeria, and I'm sure elsewhere. So there is that built-in flexibility to it. As Wash Pals, we, our mandate was to generate evidence to improve programming at scale with equity and sustainably. It's a big mandate, but in some ways it goes at the core of what this rethinking rural sanitation is as well, is that we need to bring in the evidence and contextualize it. So the Wash Pals, which comes after, well, predates actually the release of the rural sanitation guidelines, but I think the genesis of the project when Wash Pals was designed was probably along the time that you guys were thinking about what this rethinking rural sanitation would be. So it's no mystery that Wash Pals aligns tremendously with the concepts that are presented here. And from the beginning, USAID designed it to be a collaborative process. But of the 4 principles that are part of the process of partnerships, area-wide sanitation, evidence, and flexibility, Wash Pals really focuses on generating that evidence and on the partnerships. That's the P in the name, partnerships and learning for sustainability. And so I just wanted to share, I guess, a few examples and just a few thoughts on how this collaboration has gone over the years. And when Wash Pals started, we were mandated to work in, and folks may know, on community-led total sanitation, on market-based sanitation, and then a few questions around hygienic environments for infants and young kids. In the first year of the project, we did tremendous desk reviews, consulted with partners, including UNICEF, and this to come up with a set of research questions and a learning agenda that was timely, that was relevant in the sector, and that met a lot of the conditions and the criteria that are listed here. And one of the things that seemed to really find its way into our work was the classification, the community classification. And I saw that Cambodia as well did that, but this segmentation of that, and recognizing that the rural sector is not this homogeneous thing, that there are the rural remotes that have different needs than those that are closer to the road and whatnot. And so we started to think about our work along those lines. The mandate for Wash Pals was rural sanitation, but you need to go a little bit deeper in dissecting that and understanding what the needs are in different sectors. And I think in understanding the cohorts and the factors that influence decisions along those different community groups, classification groups. And one of the activities that we undertook was trying to get an understanding of the factors that influence community-led total sanitation. So we looked at environmental factors, at community factors, at different kinds of things. And one of them that came up was, as you might, no surprise, was remote. Remote communities. In some ways, CLTS works better in those communities, but not always. And when we looked back at the guidance, and it talks about community context and situation analyses and these different classification types, we thought, well, one of the things that we could contribute, building on the factors work that we did, was to develop what we call the sanitation planning tool, a SAN plan, which I don't recall if we coordinated with WaterAid Nigeria or Cambodia in the thinking of it. And so, but there was some thinking and some collaboration along those groups to develop that tool. And the idea was to, using publicly available data, to try to map some of the factors that affect these different types of communities. And so some criteria were set for what defines rural on road, rural mixed, rural remote, and overlays these social and environmental things so that it could be used as a tool then to go. I think you put up the slide of the menu of possible interventions in each of those regions. So that to me is a very clear example of how we took what was in the guidance and put it to use. It also became a factor in some of the market-based sanitation work we did, in understanding those community classifications, how that impacts market segments, customer segments, the types of products, the types of activities that can happen. Moving on to, let's see. So the other point that Mike made is that this whole process takes time. So the process of absorbing and diffusing these concepts take time. It also takes time to generate results, and those are the results that we're starting to see on the ground. So one is to get the concepts through to the folks that are actually implementing on the ground, but getting results can be challenging. And so just a few examples of where we feel that there have been results from the collaboration with UNICEF and then the work that Wash Pals has done is in Ghana, working very closely with UNICEF Ghana. We conducted a subsidy trial where UNICEF was rolling out the subsidy. Wash Pals layered on a study for that. UNICEF, having the relationship with the government, was then able to bring the government along to convey the findings of that, and hopefully will translate into policy. But us conducting that subsidy study by ourselves would have been just another study. But the value add here of the partnership was working the relationships that the in-country teams had. And again, this is not rocket science. But sometimes we forget the importance of that and continuous engagement that's needed. In a similar way, in Ethiopia, Wash Pals worked very closely with a USAID project called Transform Wash, who has the relationships with the government and has the extended positive working relationships. And so we worked through that project to do some research on some market-based demand activities that then the project infused into government policy. Now we're seeing it come out in government of Ethiopia issued MBS protocols and subsidy protocols and things like that. So things can happen on the ground, but then we need to be very cognizant of the small victories along the way. And for us, and maybe for you, for UNICEF and WaterAid, as you think about what's happening at a global level and then how that gets transmitted down to the country level, for us, some of those small wins is when we see that a USAID request for proposals incorporates some of the findings from our work. So for us, it means that whomever is drafting that scope of work had access to our information, understood it, found it valuable, and they want then those methods to be applied in country. That's a huge win. You really don't know then where that's going to go. You don't know who's going to win that call for proposals, who's going to implement, and how then those concepts might influence that organization and what they might do in a separate country where maybe the RFP doesn't call for those kinds of things, but they saw that it worked here. So it begins to take a life of its own in many ways. And so as we transition to Wash Pals 2, which we're about a year in, the relationship with UNICEF and our adherence, I guess, to these principles continues. Wash Pals 2 is very much focused on scale, on equity, on sustainability, with real attention to area-wide sanitation, to continued work on market-based sanitation, on generating evidence, and increasingly on the importance of monitoring and evaluation. Again, all things that run through what we're seeing or what might be presented and what we saw from the countries. So the one thing that struck me, I just looked really quickly at the summary of the guidance yesterday, and there was one statement about test some approaches and then apply it at scale. And I think the thinking at this point is that we need to start at scale. And so there might be some rethinking or as part of these trainings and whatnot to incorporate some of this updated thinking. The real challenge now is how do you start at scale and make things work? And when we talk about area-wide, that really is where we need to start. So I just want to thank everyone for the opportunity. Thank you, Mike. And I really do look forward to another, we have 4 years to go on this, and to continue to work with many of you on this. So thank you.
So originally the idea was to exploit your minds, or the people that are in this room. Let me just come back to the one slide that I have. So we were pretty hard on ourselves when we were like looking at this a few months back and saying, how far have we got? You know, it's been 7 years since that idea. And you know, we had so much ambition, like, oh, by 3 years, we would have rolled this out in 30 countries and we would have done all of this stuff in our countries, everything would be great. And 7 years later, and perhaps some of us in this room that have been involved in this, Johnny, who did the UNC paper, who led that team, Andy, who did task 2 and 3. And even it was Johnny's PhD that kind of kicked off a lot of the conversation between me, Darren, and Eric. So I wanted to kind of ask, I mean, what are we doing wrong? You know, I think there's challenges with regards to internal uptake. So we have like 750 staff within UNICEF. We have more than just one program. When we set our priorities, you know, you were saying, how much do we actually live these principles? You know, and it's not a simple answer to that question, right? Even when you have champions within, you still have an internal kind of struggle to kind of get things out, because this rural sanitation isn't the only thing that we are promoting. So perhaps to you guys who have been, you know, any questions around to the team, but also kind of like what strategies and tactics can you or have you taken to improve the uptake of your research? or your policy. You know, how can we, particularly you guys who might be in academia or the practitioners that are out there, how can we work better together so that, you know, we can get these things to happen and actually be used on the ground. I put that on the table, and it's open.
Hi, my name is Mark Raven and I'm with RTI. And I think I have two kind of questions. My first one is, what is the utility or usefulness of global guidance when so many issues are really localized? And that's something I think about a lot. Because when you try and make something that is global, a lot of times there's no context. And that becomes I think a barrier to really promoting things because everyone's situation is very individual and specific, a lot of metrics. Actually, I'll just leave it at that question.
Okay. Other questions? Yeah.
I have a question, fairly specific question for the Cambodia team. You know, I've always been interested in how we measure context and how we use that information to inform our program. So I'm curious how that assessment for community classification is done. Is there primary data collected or is it based primarily on distance from road that sort of thing?
Maybe one more.
Yeah, I'm a little unsure if we're asking new questions or we're trying to address your question here. I have a comment on both. In terms of the question for the panel is, I appreciate the really good presentation on RRS and certainly hearing from Wash Pals. We've all benefited from work that Wash Pals has done. I work for World Vision and we're implementers. We all know that how much we're lagging behind in sanitation as compared to water and even advances in hygiene in recent years. But you started your discussion with a slide that said, you know, that addressed the issues of why uptake has been slow and why we've made slow progress around sanitation. And one of the things that I did notice, and I've been in 4 or 5 sanitation related sessions since we started this week, and I haven't seen this listed, which really surprised me, and that's the affordability of sanitation technology of toilets. I think if you go to you cited however many million people still practice open defecation. We know that most of them are probably on the lower end of the economic scale. They're in rural communities. And if you go to them and you ask them, why do you not have a household toilet? I think 90% of them will say something along the lines of, well, I can't afford it. And it seems to be the ongoing elephant in the room. We have made tremendous advances in water, the technologies around water over the last 20, 30 years. Sanitation hasn't kept up with it. It seems to me that with the advances in material science, we have no excuse not to be able to develop from roof to the pit low-cost technology for the rural poor. It just seems to be this gap that we jump around, we dance around. And so I'm curious what the panel may think about this issue. I've been closing. I noticed that in Cambodia they're promoting the Sato pan, and I've been pestering Sato. 4 years ago I told them, you know, I said I challenge you to develop a low-cost rural sanitation, rural toilet from roof to reusable pit latrine liner, you know, for between $40 and $50. And if you can get it down to that, and they've been working on it. They just issued in Stockholm, they presented their first prototype of a reusable pit latrine liner. But I'm curious because I don't hear this coming up in our sanitation discussion. So I'd be very, of course, people have a lot of experience, and I'd be interested in hearing your thoughts.
Okay. Perhaps does somebody want to take that one first and go backwards? And I know Morris, if that's something that you want to take on, given the work that you guys did on MBS. I don't know.
Or maybe not take it on. No, I think you make a good point. I think that the advances in technology for water have certainly, far outpaced particularly the new innovations around toilets, and we're aware of the Gates toilet creation process. I think there's a lot going on there, and acceptability of technologies, the manufacturing aspects of it, the continued sense that sanitation continues to be a public good, and not something, and there is an alternative, which is to go openly defecate. So which is different than for water. And I know that's, it's perhaps a pat answer, but I think that begins to get at some of the underlying issues of all the challenges of the market-based sanitation programs on human-centered design, on assessing manufacturing capabilities, assessing the costs of, and import and export duties, and all those sorts of things. So to me, it's work that's still underway, and I think technology and technological innovations will find their way and continue to find their way into the sector, but it's going to be slow, and much needs to happen while that is ongoing. So there's the flat pack latrines and all sorts of things. A lot needs to happen to prototype those, to pilot those, to ensure that they work, that you can get the materials, you get the parts, you can unfold it once you fold it, and all those things. So yeah, it's happening, but it will take time.
Yeah, I think it's not been shared a lot in this one, but in earlier ones, that's been discussed a lot. I think there was one session, but it was more focused on hand hygiene, but they were talking about supply chains. Yeah. So I think that one is, I think the conversation has kind of rose from the actual toilet designs, which is, there's a lot out there, right? Local ones, international ones, things that you need to get shipped from one place to another, and things that you can build on site, right? So I think the challenge has been, for COVID especially, early on in 2020, a lot of our work stalled because, global supply chains were paused. So I think that conversation is beginning to kind of progress to, even, the Lixels, their challenge, they were really into that conversation because they're like, well, our problem is not the design. The problem is, how do I get our stuff from one place to the next? So I think that's perhaps where the conversation's been going. With regards to the question on context specific, and I'm going to go to the Cambodia one right after this one. So the guidance was designed to your context, because what people were doing were the exact opposite. So people were like taking a cookie cutter approach. They would say, okay, I'm going to do CLTS, and I'm going to do a national CLTS program, and I'm going to do CLTS for every single village in my entire country. And no one was having a look whether or not their villages are actually different, or the other way around. People say, I'm going to do a Sandmark program, and I'm going to run a Sandmark program in my entire country, and I'm going to expect everyone to have uptake, and then all you see, a certain proportion of the population is actually buying the latrines that they're building. So the whole idea of the guidance was to kind of steer people away from not being context specific, but actually being very context specific, which was a challenge for us, right? Because if you remember, Andy, like trying to put in everything and in it started to become like an encyclopedia, right? So identifying those examples that I could advocate, or kind of show examples where people collaborated and thought about the context in their design were the ones that we ended up leaving inside the guidance. Over to our Cambodian colleagues. Also, to say that we have Nigerian, we also have Maya from WaterAid on the phone, and they can hear us.
Yeah, thank you for the question. So the process that we do community classification, actually, to be short, the data that we collect is primary. The way that we do is we conduct orientation. After that orientation, people might be interested for the tool, and then we divide into group discussion, and then ask them to see and put the score based on the criteria. We can score from, let's say, from 1 to 3 criteria, from 1 to 3 for each criteria, and then they score themselves. And then if they see that their commune, which is the highest score that they fall into a category, so they will know, okay, my commune will be sit on whether on road, remote, or very urban or something. There are two main areas that we are facing challenge a lot between commune on roads and very urban, because it's quite similar. A lot of commune leaders try to debate and say that, okay, my commune should be sitting here, and then the other said, okay, should be sitting here. And then because of that, we decide this criteria, and then for them to score together. And after they see the score, they realize, okay, also my commune may be based on this, but the way that we do is based on context specific. We also open spaces for those community if they feel, okay, I need more criteria besides this proposed 5 of the criteria, I need more, or they feel, okay, those 5 not really, one maybe not fit to my community, they can remove 1 or 2 based on the context that they are living. Yeah, thank you.
I could just add one additional comment to the question about the value of global guidance on something like this. To me, it's one of the major benefits of it is that it does provide a common direction and a common language. And if you look at it as a document that can help open dialogue with government counterparts, I think it's important. We saw, some of that in Cambodia and Nigeria, is that the guidelines were used to interact with government to begin to affect policy. Yes, there is the implementation and the contextualization that needs to happen. But if those guidelines are set in a way, as they seem to have been, that allows for that contextualization, that doesn't lay out, as Mike said, a cookie cutter, then you have a document that perhaps serves, multiple purposes. And I think we need to look at it that way.
Maybe more like that's why I know it's also a very institute. Maybe I can back a little bit on that. How has Wash House or even this new Cambodia translated into forming the indicators that our donor agencies are using? Because to me, where the rubber meets the road, I appreciate the guidelines and the guidance, and that's often greatly fairly broad documents. But when it comes down to contracting work on the ground, it's the indicators that are used to measure what the outcomes are. And to me, that's when you can really drive it. And I'll say one of my greatest accomplishments and comments is when you say we need ground. Some of the key indicators that are moving around was successful programs. Is that influences millions of dollars in various programs? How does the work of Wash House, or how does the work of all translate them into a form of some of these indicators and metrics that we're using to drive change and polish and form and what we look at?
Where's the beer? It's too early, right?
I can start if you want, and then.
Yeah, no, go ahead, and then, yeah.
So Aaron, you hit like the $1 million question, $1 billion question. And in fact, I mean, the order is a little strange, but like one of the sessions we had yesterday was actually the baby of this, which was published last year, 2021, with Sanitation Learning Hub and 30 collaborators to come together and put a really heavy document with all the indicators that have been working so far. That now, yesterday, one of the things that we were putting together is like how to get more people involved in it, but also a smaller conversation that was happening upstairs in one of the spaces was between Wash Pals, ourselves, and sanitation learning hub and thinking about the possibility of coming up with a core minimum. The one that people can rally around. They can go with a lot more if they'd like on their project or their program, but to kind of concentrate on that smaller number so that we're actually, where I started with this conversation is hoping that we're actually able to even compare the results that one organization is doing versus another, and making sure that they're contributing to the results that the country is trying to achieve.
Yeah, I think that's right. We're going to continue to work on those. It's also what indicators are you talking about? There's a set of indicators that are needed for implementation, that are needed at a country level, to be able to do the adaptive management and to go on. And then there's a set of indicators that influence funding by the donors, and the ones that come through RFPs and RFAs and what implementers are held to some way that then need to be reported up in the states, at least to Congress. Are we making significant impacts, and why should we give the sector more money? Those are potentially different sets of indicators, and I think it's a really valid point. I mean, how do you, beyond counting toilets, how do you actually demonstrate that what we're doing is having an impact?
Well, I agree with that clarification, but I think it's a really poor job of office indicators or something that we don't do almost better. And that's where I think you're laying the infrastructure for systems approaches
right
at the ground level. And somehow how do we get, and I agree, we have a list, but here are the 10 process indicators, here are the 10 indicators. That's something we can, one page, put in front of our ocean event, put in front of our national leaders and say, look, integrate these into the following documents, and ultimately what I want, but.
No, and that's perfect, because this is exactly a conversation Jesse and I were having.
Yeah.
3 years ago in the lobby. Particularly around, when we're looking for a core set that we're able to say that USA will look for, as the UNICEF will look for when they partner with WaterAid, when they partner with Plan, when they partner with World Vision. And I think that's useful on both ends with regards to speeding up processes.
Yeah.
Sorry, Mike,
Yes.
for interrupting. Dr. Martin has his hands up. And also those who are asking the question, if they could speak to the mic or something closer so that we online could hear a bit more clearly. Thank you.
Okay. Got it. Does he have an additional question, or does he want to speak as well?
Yeah, I'm just trying to do some clarifications regarding the innovation in sanitation as compared to water supply. If you know very well that most of the tools that are really relevant to sanitation are mainly quite very simple tools, and also they are sometimes natural based. Now, if you look at, for instance, issue of gray waters, we've had issues using eco-hydrology to plants to remove some of the pollutions that you have within areas. These are very simple technology that doesn't require a lot of expensive, input. Secondly, in a simple workshop, for example, the things that can be used to tackle sanitation are always very available, and they can always adapt, compared to treating, for example, salty water using osmosis, which are quite expensive. So yes, water has really advanced in terms of technology. Sanitation, on the other hand, because of its peculiarity that is not well noticed compared to the availability of water, it will take some time, especially if people realize that it's mainly based on behavioral changes. So it is actually in line. It's just that we need to appreciate that for sanitation, technology can be very easy, and it takes some quite time to be able to move that. So I said I should just give that as a background. Thank you very much.
Thank you. That's highly appreciated. In the interest of time, we have 5 minutes left. Sarah, is it supposed to be you? Okay. I'd like to call up my colleague and friend Sarah from WaterAid America to kind of maybe share some reflections. So she didn't know what was going to happen here. So all she was here for was like really listen, and then now give us reflections on what she thought. We discussed. Thank you again to the panel.
Thank you so much, everyone. I had to reflect when I joined this session that I was with Eric Harvey and Mike in Indonesia 5 or 6 years ago when they had this brainchild to do this type of work. And so to be here today and hear all of this learning has been really interesting. You don't get to do that often in the wash sector when you hear that something is going to happen, and not everyone stays around long enough to see that something is tried and the results are found. So that's really exciting for me to hear that. I think some of the reflections, and these may seem obvious, are around, being patient in training, learning and shifting mindsets and approaches takes time. I've always reflected in the wash sector that our work is painstaking. It really is. And all the staff who work in the field and go out into rural areas, it's not easy work. And so it really does take time. And although we want quick fixes, if it were easy, we would have solved this crisis. The second reflection is around being flexible while adapting and learning. We have to hear what the feedback is during training and learn from the experience, operationalizing in different contexts. That learning has to then be taken and inform the next phase. And we really have to think about the process of institutionalizing that learning, either through mentoring or peer-to-peer learning. And I think you've already heard this today, so this reflection won't surprise anyone, but this context matters. In order to achieve this ambition of moving from national ODF targets to safely managed sanitation, we have to fully understand the level of sanitation, services in a given area, and the specific challenges hindering progress. And that has to be well contextualized in each country and region. And I think the last reflection, Mike, you might have to help me with this, is just, that big question about having 500 million people who still don't practice using the toilet, and why aren't the messages getting out, and do we have to reframe the training or the messages or how we disseminate? So those are just some reflections, and thank you all for coming. And I hope this conversation continues, and know it will.
Thank you, everyone. I don't have an answer to that question, but if any of you are interested in getting involved in this or learning more or getting access to the documents, please just approach me or my colleague Maya. Our contacts are going to be there later, or just approach me. Thank you very much for coming.
If I could just make a shameless plug, at the tech showcase at noon today, we will be demonstrating the sanitation planning tool that I mentioned. So if you are interested in what that is all about, I think it's in the sunflower room. And then I forgot to mention it before. Thank you.
Thanks, Mike.
Thank you.
And thank you for all the online participants.
All right, thank you very much, and bye-bye.
is not an issue. Oh, the force. I mean, exactly. What you